It's with great pleasure to turn the floor over to Sujata Dayal, Vice President and Global Chief Compliance Officer for Medline Industries, as well as the Chair of the Chief Compliance Officers Committee of the Advanced Medical Technology Association, AdvaMed, who will facilitate our next panel session, as mentioned, healthcare professional voices in advocating ethical conduct. Sujata is a true global champion when it comes to elevating ethics and integrity in health systems. I've known Sujata for a long time, and she has supported a number of initiatives that have achieved major milestones over the years, whether it's the G20 or the B20 and APEC and beyond. So Sujata, thank you so much for being with us today. I turn the floor over to you, and I'll just acknowledge up front that I believe one of your panelists is still in the process of switching over, so we'll look at that while you get started. So Sujata, over to you.
Thank you so much for that introduction, Andrew. It is so exciting to be here. I can remember when we started with the APEC principles in Gifu, and look where we are today. So welcome to everyone to this particular session. As you know, when we talk about ethics and integrity, it is a partnership between everyone that's involved in the health systems, whether it's healthcare professionals, institutions, industry, government. And so our panel is really going to focus on the role of healthcare professionals in advocating ethical conduct. I think healthcare professionals actually play a very unique role because they are truly the trusted intermediary for patients and people. And so as a trusted intermediary, I think healthcare professionals can really move the needle in terms of building trust and transparency, as well as establishing groundwork for how governments and industry should interact with them. So with that, we are very privileged to have a very illustrious panel. I'm going to ask each of my panelists to maybe take a minute or two and introduce themselves. And maybe as you introduce yourself, you can share with us what you think are the most exciting opportunities or challenges in this quest to have healthcare professionals, advocate for ethical conduct. So, what do you think the most important principles or challenges are, or something that we should focus on? And maybe I'll go alphabetically and start with David.
So thank you very much. Really good to be with this group today and excited about this conference. I'm David Barb. I'm a practicing family medicine physician from rural southern Missouri in the United States. That's the central part of the country. And I currently serve as president of the World Medical Association. For those of you who are not familiar with the WMA, it is an organization of about 115 national medical associations from around the world. We represent almost 10 million physicians around the world. And I think it is important to start this conversation by reminding us, ourselves and others, that the medical profession has significant standing when it comes to ethics, especially around medicine and healthcare, of course. Essentially, all national medical associations have ethical code and principles. The American Medical Association, for instance, was established in 1847, and one of the first things they did was establish a code of medical ethics. Same thing with World Medical Association, established in 1847. So number one, we need to assert our standing in medical ethics. Number two, particularly in pandemics such as the one we're experiencing now, when it is a healthcare crisis. It's somewhat different than the natural disaster such as an earthquake or a typhoon, in which we have an ongoing health crisis where we have limited resources and clear prioritization is going to be needed. So I think involvement of physicians and medical organizations at all levels is critical, and I think we have seen that in this pandemic.
Thank you, David. Jeff, maybe we can go to you next.
Sure, thanks very much. And again, pleasure to be here, and many thanks for the invitation to be on this great panel. I'm Jeff Blackmer. I'm the Executive Vice President of Global Health and the Chief Medical Officer for the Canadian Medical Association based in Ottawa, Canada. In terms of opportunities, and some of this will reflect the comments that David just made as well, I think healthcare providers really have established themselves as a credible voice that patients and the public look to be guided by science and evidence. And this has become more important at this point in time than probably ever. And this really provides us with the credibility and the legitimacy when it comes to setting not just scientific and medical, but ethical standards as well. And that's critical for the profession. I think one of the challenges that we have is that while individual healthcare providers are generally very well regarded and very well trusted by patients and the public, we need to continue to work very hard to make sure that our organizations are seen in that same light. And again, this I think reflects a little bit what David was talking about. We all have codes of ethics and professionalism. We need to make sure we live and breathe those every day. And part of that involves continually making sure that we reflect on potential conflicts within our organizations and that we really continually put the patient and the profession at the center of everything that we do. Sometimes that's easier said than done, but anything that we do to erode that trust really will come back to haunt us in the future. We need to make sure that we live our ethical standards every day.
Thank you, Jeff.
Thank
and
you.
Jose Luis, I know you were having technical difficulties, but hoping I can see you, so hoping you can speak up too.
I hope so. Thank you very much. And I am very pleased to be with you, particularly with Jeff, old friend, and Barb also, our colleague from the World Medical Association. Thank you very much. May I speak in Portuguese?
Absolutely.
So I will do it. I will change to Portuguese. So, eu sou anestesiologista e
So I'm an anesthesiologist and I work in intensive care. And I'm currently the president of the Paulista Association of Medicine. And in São Paulo, we have 140,000 doctors, and the state's population has 40 million Brazilian citizens, approximately. So I was president of the Brazilian Medical Association and also the World Medical Association approximately 10 years ago. Currently, I'm a member of the Medicine Academy in Brazil. I would like to remind you that the scientific and technological progress, which is very accelerated because of the interaction between clinic and the industry, the product, the biomedicine industry brought to our relationship a world that overcomes even the most creative fiction writers in history. I believe that Asimov, Julio Verne, and Arthur Clarke, surely they would not be able to think of what we're living today. Today, we are capable of connecting millions of brains through fiber optics with a speed close to the speed of light, which apparently it's actually slow when we imagine the speed of communication between our own neurons. Today, we are able to make ourselves be heard and to also listen everywhere on the planet. And we can also make ourselves seen and also see anywhere in the planet. We have traveled to other planets, and we have also planted to the interior of ourselves. We have decoded our own genes, and we are capable of even changing them and doing the same with the genes of the beings around us. So therefore, we are able to diagnose, prevent old diseases and new diseases as well. However, we are actually still far from having a healthy life because the benefits of this progress, these huge benefits, are still far from a considerable part of humanity. Health is something that will only reach us if it comes from the collective action. And the challenge of our time is to try to extend this entire progress to the billions of human beings that don't know this progress. They don't know what health is. They are completely unaware of what medicine is. Therefore, this is our challenge, bringing equity to healthcare, offering quality care to everyone. Like our president would say for the American Medical Association and the World Medical Association, I'm going to pay him homage, Young Kobol. I think all of us remember Young Kobol very well. And Young Kobol would say always that medicine is care, is health, and is ethics. First, taking care well, and this care brings us proximity, brings us closer to being able to, do our profession. Science is a tool, and it is essential for this care to be translated into results. And ethics is the correct application of these tools of science in care. Therefore, giving attention to these three pillars that we have that hold medicine and doing it equally is absolutely essential. And I think that is the challenge that we have to face. We have tools and opportunities that's never going to lack.
Thank you, Jose Luis. So I'm just going to try to summarize for the audience very quickly some of the concepts I heard. I think all of you talked a lot, and I think that's the importance of this panel, the standing of healthcare professionals in society, the trust and the ethical behavior, being able to model that ethical behavior, whether it's through industry codes or having a voice, and being really advocating for the patients being very important. I think another concept that was brought up that's very important is reflecting on potential conflicts so that we can always put care of the patient first. And then Jose Luis, I think you brought in a lot of good points with, just the evolution of the science and how you utilize that science in an ethical way to make healthcare available for everyone. So some really important principles right out of front. Gentlemen, I hope I got most of them there. So I think, we've talked about trust, we've talked about credibility, we've talked about using the science, avoiding conflicts, and also trying to make sure that we have healthcare applied equally for all. Did anything change for any of you with COVID? So I know all of you must have been at the forefront dealing with patients. It's been quite an evolution from, just as I saw it as a potential patient and someone in the healthcare industry, of being faced with, as one of you put it, a healthcare crisis, and actually learning along the way. And so the care has evolved, the interactions have evolved. Very curious to hear, if you would share with the audience any learnings from COVID that would change the way that you practice medicine, or any learnings from COVID that you think have, an impact on the ethical principles we have, whether it's interaction with industry or patients. Again, just for simplicity, I'm going to go in alphabetical order. So David, I'll start with you.
Thank you. So I guess I will start by saying, if we haven't learned, shame on us. We have had an opportunity in this pandemic to take a good close look both at ourselves as a medical profession, our healthcare systems, as well as the partnerships that we have with those stakeholders outside of medicine. I think what some of the learnings are, we were not prepared for a pandemic of this scope and duration. I would say that we do perhaps a credible job at generally preparing for disasters, but those are the disasters that are limited in geographic scope in most cases and limited in time duration. If a hurricane hits the southern coast of the United States, or an earthquake hits a part of the Southeast Asia, we can mobilize resources from other parts of the country or the world to come to their aid. And we know that while the event itself is over and the cleanup will take some time, there is a finality or a finite timeline that we can consider. What we're seeing with this is that none of those are the case. This is both broader in scope. It's impacted almost everyone at the same time. We have found that often our supplies and our supply chains were not up to the task of meeting the needs. And I think the other part of this, as we relate this back to ethics, is we found that we, to the extent we do a good job at all, we do a better job with what I would call the technical part of the planning than we do with the ethical part of the planning. Because as we faced challenges in supplies, personal protective equipment, emergency medical supplies, even healthcare facilities and hospital beds and ventilators, we found that when we were forced to make ethical decisions about prioritization, we were probably not quite prepared for that. So we can learn, I think, to be more explicit in our ethical preparation for disasters such as this, just as we will become more explicit with regard to our technical preparation.
Thank you, David. Jeff?
Thank you. Yeah, David made some really good points there. It's sort of reflected back to our experience with SARS, where Canada was one of the harder hit countries about 16 or 17 years ago. And out of that came a lot of reports about what we should do differently next time. And we put them on a shelf and let them gather dust, and we didn't learn from that. And so we found ourselves, just as David says, in this sort of acute situation, having to very, very quickly learn from the experiences of the countries that were hit first and try and sort of adapt to that. So one of the first things we did at the CMA was develop a triage protocol in the unimaginable circumstances where we would be having to make life or death decisions. So there were a lot of really core fundamental ethical issues very early on, that we had to grapple with very quickly. And now we're on to the really crunchy issues of the equity of global vaccine distribution, vaccination mandates, converting anti-vaxxers, all these other types of really difficult issues. I just wanted to spend a minute just sort of unpacking. David alluded to the supply chain issues. And this is something I've been fascinated in, is this new intersection between medicine and private business that's always existed. It's always been there, but it hasn't impacted frontline physicians, as far as I can tell, ever before in the way that we've seen this. So from day one, when we were struggling to procure personal protective equipment, and all of our medical associations were neck deep in that process, trying to make sure that our colleagues had access to masks and gowns and gloves and things that they needed, right up to today, where so many countries are struggling to procure vaccinations and the vaccines in the numbers that they need. We have not before seen this dependency on clinical care on the supply chains and private business. And to me, this is one of the things we really need to learn from this pandemic. And particularly now that we're seeing a lot of countries, not excluding my own, sort of turning to a nationalistic business approach, nationalizing some of the manufacturers, internalizing the supply chains. It all makes great sense in terms of each country doing what it can to avoid these problems in the future. The problem is that it doesn't help with our equity issue. And so low and middle income countries will continue to struggle. And in fact, the discrepancy potentially will get greater. And so I'm really interested to see moving forward how we try and square that circle between this idea that we need to have countries that can react quickly during a pandemic without relying on ships being able to make it through the Suez Canal, but at the same time, not ignoring the needs of countries who do not have the internal resources that they need. So, and I think we don't want to leave that solely up to the business community and governments. We need to have healthcare providers at the table because, as I said at the beginning, we really saw the impact on this from day one on the front lines. It wasn't a theoretical issue for us. This was very disconcerting for a lot of our colleagues.
Some really interesting observations there, David and Jeff. And Jose Luis, would you like to add your thoughts on that?
Yes, thank you. O que nós aprendemos? Eu gostaria de me limitar a dois aspectos. O primeiro
Yes, I would like to limit two aspects. Like David mentioned, the natural disasters have multiplied in the last few decades in particular, whether it is in frequency or in the number of casualties. Even though we are aware of that, we are not fully prepared and integrated to fight that. So I think that's one of the lessons that we cannot forget based on the immense disaster in which we're living right now. Second, once again, it has become clear something that we have known for a long time. The plague does not come by itself. It is always followed by ignorance and intolerance. So the energy and the strength to fight the disease, the virus itself, it has to be applied with the same strength when we're fighting ignorance and intolerance. Also, communication, which the technological progress provided us with a lot of intensity. Communication is essential so that we can identify, characterize each problem, so that we can debate and reach solutions. Infodemia is fought just like the pandemic, with correct information. And transparency in this process is a sine qua non condition so that we have the credibility to get to solutions together. We have to keep alive within the society the debate of issues related to ethical dilemmas. We as physicians, we live isolated, dissociated from the rest of society regarding these ethical discussions, because when we had to discuss with deal with real dilemmas, we will not be able to assume coordinated positions with other layers of the society. So the solutions regarding healthcare are not going to be found only in the healthcare ecosystem, but with the integration of all the layers of society, including a discussion with all the other sectors about healthcare ethical dilemmas, local solutions, regional solutions, national solutions. They are inevitably fragile and ephemeral. Healthcare problems need global strategies. And I believe that that's what we are trying to do.
Thank you. So to sum up some interesting thoughts, which hopefully will lead to the next question, some things that I heard, lessons learned, I think, around preparedness. So the fact that probably most of our countries are very prepared or somewhat prepared for what I would call natural disasters of limited duration, but perhaps not as prepared for something like the pandemic. As we've seen, COVID's gone on now for more than a year and it has evolved. So heard some thoughts around, how we can better be prepared. I think, Jeff, you talked about it, the fact that, you kind of have a post-mortem about this. A number of reports are written, but how do we get those reports off the shelf? And while we may not need it, or we hope we don't need it, have that playbook ready for the next pandemic or the next crisis. Like I said, hopefully we don't need it, but we should always be prepared, right? I heard some really interesting thoughts from, I think, all three of you about maybe more than ever before, the COVID pandemic has brought to light the partnership and the integration and the coordination that's needed between the healthcare professional community and industry and government when it comes to supply chain issues and, making sure the right supplies. I heard a little bit about the ethical dilemmas of when you have limited supplies and limited healthcare available, how do you make those decisions on how to allocate, whether it's treatment, supplies, vaccines, hospital beds? And then I think Jose Luis, but the last point I'd like to bring in, I think you covered a lot of those, is the fact that maybe this last year has highlighted more than ever for all of us the need for some global principles. So something like COVID brings to light the fact that it's not just a regional, local, or even national issue, but when we have a global issue, how do we apply those principles globally? I think all really important, and I do think the healthcare community plays a big part in that in terms of, you know, how do you decide to allocate patient care? What supplies go where? I heard a lot from both all of you about communication and education around vaccines. You know, what is the science behind it? Why should people take them? What is the resistance? Educating people so they can make appropriate decisions on how to proceed. So with that, I'm going to take all of that, which is a lot, and I'm going to ask each of you to unpack it a little bit and maybe talk about what you would do differently. And maybe we can start by focusing it on some of these partnerships that we've talked about, whether it's the partnerships with industry or the partnerships with government. So let's start with that piece. And what would you do differently from a partnership perspective and expect from governments and industry? And where would healthcare professionals take the lead? Again, I'll go alphabetically. So David?
So many things. I will try to be brief. We have referred before to our medical organizations and what I would call frontline physicians who actually deal with these things, who have had the most direct and up-close experience and who have walked into danger themselves to deal with the issues around this pandemic. While I have sincerely the greatest respect for my physician colleagues who have moved into administrative roles in our state and national governments, that takes them one step away. And I fear that they have not relied on their colleagues, those of us on the front lines, those of us bringing together physicians in a professional organization to pick our brains and get our responses. And so that partnership between healthcare leaders in governments and potentially, let's say, medical directors in industry need to interact more with the colleagues that are on the ground. I think that's number one. To take another turn, COVAX, while it hasn't been perfect, is an interesting model that we might be able to, certainly we can improve on it with respect to vaccines, but it is an interesting model that we might also extend to some of the other supply chain issues to look at how we can make distribution of essentials available to those countries that perhaps might have difficulty acquiring them on their own. We do need to do better in stockpiling those materials that we know now will be needed, particularly in the early days of another wave or a different pandemic. We cannot prepare a year's supply of everything everywhere, but once we have a distributed, appropriate international stockpile, then back to some of the comments Jeff made, we need to know how we are going to pivot our industry to gear up to produce what we need the most. I use ventilators as a very simple example. In the United States, at least, you know, we converted old automobile manufacturing plants that weren't being used into ventilator manufacturing plants. We can think ahead. What industry could produce which good or service that would be needed in a pandemic? And let's plan for that. So that while we have an initial stockpile to get started, how will we meet the demand, some of which we may not be able to anticipate right now? And then lastly, we as health professionals have the best perspective on how do we then use the limited resources, because there will always be some limitation of resources no matter how well we plan. How do we use those in the most efficient way? If I read directly from the WMA statement on medical ethics in the event of disasters, it says physicians should order priorities for treatment that will save the greatest number of lives. We know how to do that, and we can do that even with vaccines, and we're well into the vaccination process. But where there are still limited resources, we know how to direct those to those individuals that need them the most, that will prevent the most morbidity and mortality. And I will say that we simply have not done that well. We didn't do it well in the United States. It is probably not being done as well in other countries. For instance, in the United States, and I think in many other countries, the vaccines were prioritized to people over 65 and those with some chronic health conditions. That's fine. That's a good broad category. But even within that category, as broad as it is, we could have done a better job at targeting those individuals who needed the vaccine first and most. Even those who were not able to get to an access point to get it, we could take the vaccine out, and we didn't in most cases. So we've got a lot that we can improve on.
Thank you, David. I'll hand over to you, Jeff, to get your thoughts as well.
Yeah, thanks very much. I think, this is in many ways sort of the heart of what we need to learn from this pandemic, at a really high level. And I reflect back, Jose Luis, as always, has had so many eloquent pearls of wisdom in his comments. And one of them that I really appreciated was that healthcare problems require global strategies. And we really need to internalize this. And so I think back to all the great work that the WHO has done, for their flaws, like any organization. They really have stepped forward at this time and been very clear in terms of where we need to prioritize, the need for equitable distribution of vaccines. As David said, provided a clearinghouse in COVAX. They've really done a lot of excellent things. And what has it all meant? Not much, because the real power comes at the national level still when it comes to healthcare. And so I think without the WHO, these important conversations would not be happening. But I think we still see the inequitable distribution of vaccines and other life-sustaining and saving therapies in countries like my own around the world. And this is a real problem. And so to me, the big conversation needs to happen at the intersection, to your original question, Sujata, the intersection of the profession, business and governments. And this is why I've become engaged in APEC. And you referred to this at the outset, Sujata, the work that APEC has done around, the interface between healthcare and private industry. And the power of that organization is bringing those three layers to the table, which is so rare, and doing that in a transnational type of way, which is even more rare. And so you have these tables where providers, patients and the public, civil society, governments, and industry come together, and it's done in a consensus building way that allows people to participate meaningfully and not feel like they're going to be outvoted or that their voice will not be heard. So it's not a model that necessarily lends itself to every issue, but it is something that can be very, very, very powerful. And I'd love to work over the next few decades, maybe, to try and leverage some of the things that we learn in that setting to the global setting. Because again, to me, this is the real challenge coming out of this, is that, you look at some countries, I mean, New Zealand locked themselves down yesterday with one new case, right? Very wealthy country, citizens that listen very carefully to their government, superb engagement of healthcare professionals, and business fully integrated in the conversation. Extremely successful in New Zealand, right? How do we learn from that and take that outside of the borders, whether it's on a regional or a global basis? To me, that's what we really need to learn from this pandemic. Some countries have done a great job, but internationally, what it's really done is exposed on a scale we've never seen before, the profound inequities in access to healthcare around the world. Thanks.
Thanks, Jeff. And Jose Luis?
Esta uma situação muito.
Well, this is a very interesting situation that actually gives margin to so many possibilities in terms of views that we can take. When we live through a disaster, whatever it may be, frequently we are all mobilized trying to control the situation. But once the initial wave has gone away, the initial problem has gone away, we usually forget it. We forget about it. And I'm going to remember an episode from around 10 years ago. 10 years ago, I was at a Canadian hospital. So Jeff is going to remember this story. I was in a Canadian hospital in Licay in Haiti. And I was working at a humanitarian project facing the earthquake in Haiti. At the time, it wasn't possible for us to work in Port-au-Prince because the city was too affected by the earthquake. So we went to Licay. And today, exactly 10 years later, we have yet another earthquake which affects Licay directly. So exactly, destroying the hospital where I had worked 10 years ago. And so therefore, this seemed like something that was a paradox. I can't accept like the whole world followed that previous disaster and we allowed for it to happen again 10 years later, exactly the same in the same place. So we can't let this happen again. That's what I'm trying to say. What is happening to us today cannot repeat itself. We need to bring this forward. Even though today we have, huge power, we have huge technological power at the moment, it is very interesting how we were able to develop in just 1 year or in less than a year, not only developing vaccines, but making them and applying them in so many people in such a rapid rate. So it is fantastic. It's amazing. And we realize that we are able to develop effective medication, even though expensive and completely inaccessible to be able to face this new disease. But it is possible. It is absolutely important for us to have enough humility to understand that all of this knowledge only gives us a dimension of our ignorance, of how much we lack, how much we still have to do. So we need a lot of caution at the moment, not forgetting everything that we already went through, trying to maintain ourselves in the land in the sense that we are trying to avoid the repetition of previous problems. This is the case, like I told you, and this disaster that we're currently facing, and also the disaster in Haiti. And just to finish an observation from what David said at the beginning, for many years, I worked with artificial ventilation, and I knew a notable engineer in Brazil that maybe developed some of the best respirators we know, and I had the pleasure of working with. And having finished his company, which was a great loss for the company, we are only realizing it now when we saw that we needed local production of quality equipment. When he closed his company, he decided to dedicate himself to the production of essential equipments that were not, didn't have the first goal of use to have financial gain, but efficiency anywhere in the world, low maintenance, easy use, and durability as well. Great. So I think that maybe a lot of engineers in the world trying to search for that parallel with top technology would be fundamental, because we need this type of mind and research. And maybe we would also need, and we have enough material here for many meetings, of course, of the World Alliance of Health Professionals, because each doctor individually has a lot to do, but they can go much further if they're associated and if they're aligned with other health professionals in the field. And of course, our proximity to the industry, the medical equipment industry and pharma industry also needs to be done in this sense, not in the sense of, we need to focus on what is essential. And what is essential, what is lacking today, and they did lack in the past and they will lack in the future many times over. So we need to accept this fact. We need to have humility to recognize this.
Thank you, Jose Luis. So again, I'll maybe unpack this a little bit for our audience and try to combine all of your thoughts. So, and I'm going to start with Jeff's comment about collaboration. So, the importance of forums like this one, where we can bring multiple stakeholders together, where we can collaborate and work together on, on issues, whether it's ethical principles or a crisis or a pandemic, just the ability to have forums, openness, and collaboration. I think all of you talked a little bit about extending that collaboration to thinking globally, not locally. So the importance of having global principles. And then Jose Luis, I think very important point, which we've kind of talked about a little bit before, is we need to learn from the past and not forget about the past, but use the past to help us move forward and deal more effectively with new issues. And I do think all of us, once we get past a situation, often move on to the next crisis. And we forget about those lessons learned until we have to dust off those reports again. And then just an interesting thought that I think came up through all of your conversations, especially talking about ventilators, which is the importance of innovation. So, Jose Luis, you talked about the gentleman in Brazil who kind of moved from ventilators to other, important medical equipment. David, you talked about how, in the US, we converted automobile plants to make ventilators, but maybe thinking innovatively ahead of time about things that could help us prepare for the future, even if we don't, have the automobile plant up and running, but knowing that we could have it up and running if we needed those ventilators. And so to me, one of the things, and I hope our industry colleagues are listening, because I do think innovation is one of those places where the industry and healthcare professionals and the government can work very closely together. And then I don't want to lose sight of one very important principle, and I think it came up through all your conversations, which is the importance of the healthcare professional who's actually on the ground, because they're dealing on the day-to-day, and they are our best source of intelligence of what's needed. So hopefully I summarized that. We're getting close to end of time, so I'm going to give you a one-word challenge. I would like each of you to think about one word, or maybe it's one sentence, that describes the most important ethical principle that you think we should be focused on. And David, you beat me to it. You've already unmuted. So.
It's a pattern here. I think equity and justice in distribution is what we must strive for, and everything else is how do we get to that point.
Yeah.
So in homage to my American colleague, David, Bill Clinton once said when asked about the key issue in the upcoming election, it's the economy, stupid. And in this case, it's global inequity, stupid, all day.
Jose Luis.
Não, eu não tenho qualquer dúvida.
Well, I don't have any question. I mean, we're all unanimous here. Equity and care and healthcare is the main challenge of our time.
Thank you, all three of you. Totally agree. Equity, justice, distribution of healthcare are very important. I'd like to thank all of you, as well as those that joined us to listen to this panel. I think we got some wonderful insights on the role that healthcare professionals can play in helping advance ethical principles, given their role in trusted advisors, the intelligence that they bring to the ground, the importance of collaborating together, both as industry, government, and healthcare professionals, and frankly, the importance of forums like this where we can collaborate and thinking globally, not just locally. So with that, I'd like to thank everyone and hand over to Andrew.
Thank you so much, Sujata, David, Jeff, Jose Luis, really for sharing these absolutely vital perspectives from the healthcare professional community across the region and around the world.